Hi, I'm Dr. Joe Suker with the Arizona Trauma Association, and this is Trauma in a Flash. Pelvic fractures are like a box of chocolates. There's a wide variety of different types. Unfortunately, there's no label on the box to show us what's inside. Fracture patterns range from simple pubic rami fractures that only cause pain to unstable fractures with life-threatening hemorrhage. Today, we will focus on open book pelvic fractures associated with high-energy mechanisms such as motor vehicle crashes and falls from significant heights. Most pelvic fractures are not readily identifiable on physical exam. Even unstable pelvic fractures are rarely associated with clear external findings. However, some external findings may include severe pain to the groin, iliac, or pubic area, and bruising to the area of the hips, pubis, or genitalia. The physical exam should include palpation of the pelvis, observing only for tenderness. You should not perform the so-called pelvic rock. This is unnecessary and may cause further injury. If you suspect a severe pelvic fracture, limit log rolling to only what is absolutely necessary. Application of pelvic binders in the pre-hospital setting should be considered only for patients who are hypotensive and have the appearance of a widened pubic symphysis with splayed and externally rotated legs. These are signs associated with open book pelvic fractures that may be accompanied by life-threatening internal bleeding. A properly placed pelvic binder may help with bleeding control by closing the pelvic volume, allowing for possible earlier tamponade. Application of a pelvic binder to fracture patterns other than this have the risk of resulting in further complications. Closing the open book pelvic fracture can be accomplished with a simple bed sheet. However, there are many useful commercial products that I feel are easier to apply than a bed sheet. You want to center the pelvic binder at the level of the greater trochanters. This is at the same level of the pubic bones, which are easily palpated in the anterior midline. Roll the patient utilizing spine precautions to place a binder under the patient. If you're using the pelvic binder or T-pod device, you want to leave a 6 to 8 inch gap to allow for proper application. The SAM device is applied in a similar fashion, but has a belt and buckle assembly that is simply pulled until tight to achieve proper fit. Finally, pelvic binders can cause pressure necrosis and should be removed as soon as possible. Thank you for watching this week's episode of Trauma in a Flash.